Okay, good morning, everyone, and thank you for joining us today. My name's Christy, and I am a GCAP trainer with San Diego PACE. Today, we are going to be presenting on communication, the skills and practice, especially in communicating with those living with dementia and Alzheimer's. During the presentation, my camera will be off. However, the chat will be open for any questions that you may have and for any participation. Let's go ahead and get started. So again, today's presentation is on communication, the skills and practice in communicating with those living with dementia and Alzheimer's. We're going to cover why communication is important, how we can communicate, some nonverbal versus verbal communication. And then we're going to go over some tools and skills such as introductions, completing tasks, providing care, options, labels, redirecting, reminiscing. We'll have a few practice examples and then we'll conclude. So first, why communication is important. As dementia and Alzheimer progresses, it affects gradually how a person can communicate. Communication is going to help us understand the person that we're caring for's wants, needs, and emotions. It also helps keep their sense of self. In their sense of self, we think about their personality traits, their abilities, and their likes and dislikes. It helps them maintain their qualities, their well-being and happiness. And it also helps us in reducing agitation and frustration. How to communicate. First thing we want to make sure is that we remain calm, patient, and respectful. Sometimes in certain situations, it's kind of hard to remain calm and patient. It is okay to take a break, step out for air if you need to, but the important thing is that we remain calm, patient, and respectful when communicating. We want to keep a friendly and positive tone of voice and limit distractions. Sometimes with older adults, especially with those with Alzheimer's and dementia, if there's a lot of distractions, it's hard for them to understand what we're saying or to hear us properly. If the TV's on, music is playing, you're doing dishes while communicating, sometimes those distractions can hinder the conversation. Think about how you feel when you have difficulty expressing yourself. You may begin to feel frustrated. You may have anxiety, some symptoms of depression or being withdrawn if you can't express yourself freely. As older adults or those living with Alzheimer's and dementia, when they are frustrated, you want to avoid arguing with them, correcting them, or reasoning. A lot of times this is going to escalate things into increased frustration, especially when we're reasoning with them or trying to bring them into our reality. This is going to escalate the situation a lot more. Nonverbal versus verbal communication. We want to think about the message that we are trying to send to the person. What are some examples of nonverbal communication? If you guys want to put in the chat what some examples of nonverbal communication is. Gestures, yes. Visuals. So nonverbal communication, communication is definitely more than just the words we speak. It's how we say it too. The way we sit and the way we stand, the amount and the speed at which we move, our facial expressions, and eye contact. So we can show our tone of voice might be pleasant, however, by our facial expressions, the eye contact, if we're rolling our eyes, we can portray some disgust or being upset with the person if they're frustrated. Eye contact is really big. There are some cultures that do not believe in maintaining eye contact. However, for the majority of older adults, especially those living with Alzheimer's and dementia, um, speaking to them at eye contact or close to them does help de-escalate situations. That nonverbal communication can help or can hurt the communication, so we must use it correctly. Again, a person with Alzheimer's or dementia may lose their ability to verbally communicate, but they're still able to understand the social communication cues, such as the nonverbal communication. Whether we're maintaining the eye contact, whether we have a smile, crossing our arms, waving our arms, sometimes a thumbs up or an okay sign, or even touch when we're transferring someone that we're caring for. If we have a controlling grip versus a warm hug, that can be noticed. Also, space. If we're too far away from them or too close to them, that's also something that's noticed. In the pictures below, who do you believe is communicating effectively, and how can you tell that they're communicating effectively? The right, yes, she has a smile on her face. So on the left, exactly the body language. The body language is a closed body language. Yes, the right side definitely looks more calm. Um, on the left, they could be distracted. Closed body language can include facing away or being obstructed from their view when speaking, so they're not able to understand you. The lack of body movement or extremely fast movement. So such as the picture on the left, how she's kind of waving her arms, that frowning look or the blank face can also hinder the conversation. So he's more likely to get more frustrated because he's thinking that the person that is communicating with him is upset or irritated. Versus the picture on the right, we think about open body language, so more relaxed posture or gestures. If you notice on the picture on the left, she's kind of standing over him versus on the right, she's kind of at a position where the other person can see and hear her clearly. Active listening gestures, nodding, smiling, maintaining the eye contact, and also gentle or soft body movement. So we want to demonstrate that we're listening to them and that we're understanding them. In the pictures below, we think about the nonverbal cues. What do you think the people in the images are saying without speaking? The one in the middle might have received bad news. Could be sad, frustrated, or confused. I definitely think the picture on the left, he's confused or frustrated. In the middle could even be frustrated. The left picture seems that she's arguing with him or not being respectful. Could be in pain. So I know when I got into healthcare, I've been in healthcare for about 24 years, and in caregiving, one of the main kind of objectives for me was to treat everyone how I would want my family members to be treated. I notice, a lot of times, we're so focused on the tasks that we have to do and getting in and out that we're kind of in a hurry. It may come off that we're frustrated, especially in nonverbal cues. If you're rushing to do everything, they might think that, you're in a hurry or you don't really care for them. So we want to make sure that we're still showing the empathy and showing the respect we're there for them. So in the picture on the left, I do think, he's kind of confused. Maybe he doesn't understand why she's so upset or what's going on. Also, her language is probably not coming across very clearly. The one in the middle, as mentioned, maybe he's sad or received bad news, or he's frustrated. He's unable to get his point across or express himself correctly. And in the picture on the right, um, to me, it looks kind of like she may be sad or withdrawn, kind of a lack of motivation or not communicating at all. Exactly, on the left, looking like, what is going on? Why is she standing over me yelling? When we go to verbal communication, one of the big things is our tone of voice. We don't want to baby talk to them. We want to speak to them as adults, just with simpler sentences and questions. So simple questions would be yes or no questions. Um, that's going to help in making sure that we don't baby talk with them. Also try to use humor when appropriate. Many with Alzheimer's and dementia do retain their social skills. We want to use clear and calm speech so that we're easily understood by the person we're caring for. We want to encourage the conversation and not interrogation. So we don't just want to keep asking them so many questions. We want to allow them to communicate with us. Also, another thing, just like with anybody else, if you're trying to express yourself or communicate and the other person isn't listening, that kind of increases frustrations just in general in any conversation. So you want to allow the person to finish their own sentences. Sometimes it does take older adults or those living with Alzheimer's and dementia a few minutes to get their thoughts together, but we want to try to let them finish their own sentences and not cut them off. Allow them to finish their thought process in the sentence. And commanding, demanding versus asking. So if you're telling someone, put on your shoes, put on your socks, take your medication, it kind of comes across like you're yelling at them or commanding them, and they might respond in a sense of quit telling me what to do, or they might just feel like you're just kind of commanding them in what to do. Instead, we want to ask them, hey, I'm going to get ready for your appointment today. Would you like to get ready as well? How about we put on our shoes? So it's all in the way that we communicate with them. So imagine the following scenarios and why introductions could be important. How would you react if you're sitting at home watching TV and a stranger walks into your home and says, "Hi, it's time for lunch. Are you hungry? I'll make us some sandwiches." How are you going to react to that? Exactly. Who are you? We have to remember that sometimes these older adults with Alzheimer's or dementia, they might not remember us even from the day before, or even earlier in our shift. So they're gonna not know who you are. They might want you to leave. They're probably not going to be wanting to eat lunch with you or allow you to make food in their home. In the scenario two, your daughter comes to visit. After some conversation, she says it's time to take a shower. Let's go get you ready. So depending on the wording of that, it might come across commanding. However, the daughter came, she had some conversation, the person was more likely to remember who she was, or get more comfortable with her before she initiated the time to take a shower. So that situation or scenario is going to be a lot better for someone, especially living with Alzheimer's and dementia. This is why introductions are very important. As dementia and Alzheimer progresses, the person's going to recognize you less and less, and sometimes might not recognize you at all. Those introductions help us build their trust, and it can alleviate stress for the person with dementia and Alzheimer's if they don't remember you. Introduction can be very simple. You can say, "Hi, so and so, my name's Christy. It's nice to see you again. I'm here to visit you today." And just start with general conversation. Maybe ask them how their day is going. But those introductions are going to go ahead and ease you into your shift. Next step in completing tasks. If the person that you're caring for is able, you want to encourage them to participate in routine tasks. Breaking down those tasks into small steps can also help so that they're not confused or stressed. So for in this example, we're making grilled cheese sandwiches for lunch. These are the simple questions that you would want to ask. Would you like to make grilled cheeses with me? Can you please get the butter out of the fridge? Can you grab a butter knife from this drawer? Notice how this is bold. So these questions or statements are basically broken down because you don't want to give them too many instructions at once, which can confuse them. And also that butter knife from this drawer so that they know exactly where they're getting that butter knife from and they're not confused with 10 different drawers in the kitchen that they might not remember where they keep the butter knives. If that person becomes frustrated or overwhelmed at any point in making lunch or in any of the tasks that they're participating in, you want to stay positive. You might have them sit down or suggest a different activity while you finish so that they can calm down. Maybe they have a favorite show they like to watch on the TV, or maybe they like to knit or do something like that to where you can have them do that while you finish making lunch. Providing care, whenever we need to perform a task related to someone's care, we want to make sure that we're always communicating with them. Let them know what you're going to do before you do it. In this scenario, she's saying, "I'm going to put your sock on now." It's better to over communicate what you're doing rather than to just start doing things with them to where they might get frazzled, not know what's going on, or they might get resistant to not want to put their socks on or allow you to get them ready for the day. You also want to limit options. That's going to help minimize confusion. So instead of asking someone, "What shirt would you like to wear today?" For someone with Alzheimer's or dementia and they have a closet full of clothes, for one, they might not remember, right? All the clothes that they have. It might take them a while to think about what they want to wear. Um, So a better option would be like, "Would you like to wear your white shirt or your blue shirt today?" Show them the white shirt and show them the blue shirt. Show them that what their options are so that they're not so confused and they can see and choose for themselves. Labels. So I've noticed this a lot with others in the day centers where I've worked. Sometimes they can associate negatively with certain labels. For instance, medicine or vitamins. If someone were to tell me, hey, you need to take your medicine, I do not like taking medication. I hate taking pills. However, referring to them as vitamins, they may be more willing to take their vitamins to keep healthy. So maybe saying vitamins instead of medicine. For those that participate in adult daycare centers, how would you feel as an older adult, someone telling you, let's go to daycare? You might not feel as comfortable. It might make you feel insecure. However, if that person used to be part of a social club or like a tennis club or something like that, or maybe they were really into school, they were a teacher, you can refer to those daycare centers as a social club, or maybe they're going to go to school to learn for the day. And a lot of times in those adult daycare centers, the staff they know their participants very well, so they can give them activities to where they feel like they're still part of a social club, whether they're playing cards or they have some kind of group activity, or for those that, were very much into school or were teachers, they can give them exercises or kind of little assignments that they're doing to where they feel like they're still in school. Supplement drinks. So when we think of supplement drinks, there are older adults that will drink Ensure or Boost. I don't know about you, but if someone were to give me a supplement drink or offer me a supplement drink, I probably wouldn't take it. But if they offered me a shake or a smoothie, I'd be more likely to take that. So again, we're using options or labels that help them want to go ahead and take their medications, take their supplement drinks. Um, and this is another big one, a diaper. So if you were to tell an older adult, let's go put your diaper on, that's going to make them feel very uncomfortable. You want to refer to that as underwear or some other kind of euphemism versus telling them that you're putting a diaper on them. Redirecting. This is really big when it comes to caring for those with Alzheimer's and dementia, because sometimes their reality is not the same as our reality. Our mind is thinking more logically. In this situation, the house keys are not on the hook by the door where they usually are. In our reality, we can run through checklists. We might think, where might they be? Where did I leave them? Did I leave them in my jacket? Did someone take them? We think about the who, the why, the what, the where, the how, the when. Those are things that we think about. In their reality, they notice those keys are missing. Someone stole it. My house keys have been stolen. It's automatically to the stolen. They're not thinking with that thought process of where might I have placed them, where else could they be. So it's really important that we redirect them. So the first thing we want to do is de-escalate and reassure them. I'm sorry your house keys are missing. I will look for them. Redirecting, while I look for your keys, how about you get ready for lunch? You know what sounds good right now? A grilled cheese sandwich. How would you like a grilled cheese sandwich? So we're taking their mind off um, of the thought of their house keys being missing, and we're de-escalating them so they're not just continuing to be more and more upset and frustrated because they can't find their house keys. And this could work in any situation. Sometimes with older adults, they have items that they're very close with that they like to have with them all day long. I know one of the people I used to take care of had a necklace. She wouldn't wear the necklace, but the necklace had to be right next to her on the table because her son gave her that necklace. So I always made sure as soon as I got there that that necklace was right by her. However, if for some reason it wasn't, you know, and she noticed, I had to make sure that I de-escalated that situation. I let her know that I was going to look for it. And typically, she like to watch these old black and white movies, which was really cute. So I would put one of those on while I really hurried to try to find her necklace for her. Reminiscing. So reminiscing with older adults or those living with dementia and Alzheimer's is really important because it helps boost their mood. It increases cognitive capacities and their abilities to complete daily tasks and routines. It also validates their life and it restores their sense of self. So again, their sense of self is retaining their personality traits, their abilities, their likes and dislikes. Reminiscing also allows them to connect with you, to socialize, and to communicate. Someone with Alzheimer's and dementia might not remember 30 minutes ago, but they might vividly have those memories from 10, 20, 30 years ago. So if you can use photos that may be around their home or the environment or music to stir their emotional engagement, it might bring forward those happy memories. So for example, they might not recognize maybe, you're 45, you're their son, and you're there to care for them. They might not recognize when you come in. However, they might recognize a picture um, from when you were 10 years old. So just having those photos around and letting them reminisce on those memories. You can use that with other communication tools such as your open communication and body language and active listening. The reason why we have this tell me more about blank. So sometimes as caregivers, like I mentioned before, we're there for a certain time frame and we have so many tasks that we have to complete within that time frame that once they start reminiscing, it might be easy for us to say, oh, you already told me that, or I already knew that. But that kind of response can actually trigger them to be frustrated, like, no, I never told you that. What are you talking about? So if someone's reminiscing with you, you kind of just want to say, oh, that's interesting. Tell me more about that. When you're frustrated, try to remember not to take it personally. They're living with a disease that affects both of you, and they experience their life differently than you. Remember, their reality is not always our reality. Their past life experiences reflect the world that we may no longer live in, so they might not understand the different ways that we're communicating. And this is really important too. Their behaviors may have an underlying purpose or cause that they can't express to you. So if someone is frustrated, acting out, maybe yelling, can you think of some reasons or some ways that they might be showing this besides vocalizing that to you? In other words, if they're kind of yelling, how might I know it's because they're in pain, or there might be a reason why they're yelling at me? So maybe you notice that they're yelling, um, but they're wincing, or they're grabbing their head, or they're limping, or they're favoring one side. So that's how we might know that their behavior is showing some underlying cause that they're in pain, or there's some other reason for why they're so upset. We want to think about that too. We could definitely not fix, change, or control them. And what works for you today may not work tomorrow. So it's really important when we're caring for others, especially those with Alzheimer's and dementia, that we keep an open mind and we try different methods at, de-escalating them, reassuring them, communicating with them, because something that I may have done today, like with that those house keys, it may not work tomorrow. We might not be able to redirect them into thinking of making a grilled cheese sandwich. We might have to try other things like showing them a picture and having them start reminiscing about a loved one, or we might have to put on their favorite show. So try different tactics to try to de-escalate those situations when you're feeling frustrated. Another thing when you're frustrated, remember that it's okay to ask for help. A lot of times, we think of caring for others, we forget that, if we're frustrated, we're not able to care for others as well. So whether that means you go take a walk if you're able to, you step out and get some air, um, make sure that when you end your shift or you end your time with that person that you're caring for, that you go um, get enough sleep that night so that you're able to be refreshed for the next day. We always want to make sure that it's okay to get help and it's okay to take care of you so that you're able to take care of others. So let's put this all together. In our first scenario, we just arrived at the person's home. They're watching TV in their pajamas and they have a doctor's appointment that they need to get ready for. How are you going to start your communication? Remember that you just arrived there, they're comfortable, they're watching TV in their PJs, but you have a goal. You need to get them ready for their doctor's appointment. How are you going to initiate your conversation? Remember everything that we've covered in this presentation so far. Yes, first things first, we want to introduce ourselves. Remember, so that we don't come in intimidating, we don't come in and confuse them. We want to let them know who we are, remind them who we are in case they've forgotten us or they don't remember us. That's really important. So in this scenario, after the introduction, just remember that part in the presentation where we mentioned commanding versus asking. So after we've introduced ourselves, hey, Maria, my name's Christy. I'm here to visit with you today. We want to ask them, you have a doctor's appointment today. I'm going to start getting ready. Would you like to put your socks on? Would you like to brush your hair for your appointment? So you want to ask them questions and rather than command them to start getting ready. So in the same scenario, and this will happen in caring for those with Alzheimer's or dementia, when you mention that they have a doctor's appointment that they need to get ready for, what if they respond with, what doctor's appointment? I don't need to go to the doctor's. There's nothing wrong with me. They start becoming frustrated. How can you de-escalate the scenario so that you can get ready for the appointment? Does anyone have some ideas on that? So depending on this scenario, as caregivers and family members, we know that sometimes ultimately, that doctor's appointment might need to get rescheduled. However, we want to try from having that appointment rescheduled. It's really important for them to maintain their preventative care appointments or their doctor's appointments. So yes, that is good. Stay calm. Remember to keep your positive tone of voice. Remind them of the importance of going to that doctor's appointment. And remind them of what that doctor's appointment is for. Also, yes, try telling happy stories. So if they have years and years with the same doctor, you might be able to remind them like, oh, it's Dr. So and so. Last time we had a really pleasant visit. We're just gonna go have a little checkup again. That definitely, yes, can help change their mood. Let's go to the next scenario. In this scenario, you've been with the person for a few hours and now it's dinner time. This happens a lot. When you first arrived, they mentioned that they wanted chicken for dinner. So you just finished making the chicken for them. Whatever time it took you, you just spent that whole time making the chicken for them. But they start to get upset and they start saying, I don't want to eat this. I hate chicken. How do you respond to that? Remember, they might not remember telling you that they wanted chicken. They might not even remember that they like chicken. How can you respond to them getting upset? Yes, staying calm and your body language is definitely important. If you become frustrated because you just spent that time making the chicken, you don't want to wave your arms and start saying, you told me you want the chicken, right? You don't want to tell them that they told you that because, again, they don't remember telling you that they wanted chicken or that they like chicken. So make sure you stay calm, use the correct body language, the open body language. Maybe you can try to reconnect a memory. Encouraging them to try it is really good, yes, because if they think they don't like chicken, but you can get them to try it, they might remember they like it. Or maybe 10 years ago or as a kid, their favorite food was like chicken Alfredo or something. Maybe you start reminiscing on a memory like, oh, remember when you used to go to lunch with so and so, their best friend or a loved one, and you guys used to eat chicken Alfredo. So maybe try reminiscing down a memory. You definitely don't want to get upset. If you have to, you might have to pack away that chicken for another day, and, try to make something else. But if you use the de-escalating techniques, the reminiscing techniques, and you stay calm, a lot of times you can encourage the person to try the chicken or to eat the chicken, or whatever it is that you have made for them. And remember, these scenarios, might have to do with dinner, but this can ultimately be your way in responding to other things that might get them upset or frustrated. So this is the redirection scenario that we covered with the keys. So the person you're caring for is unable to locate their watch. They start getting really upset saying, where's my watch? Someone took my watch. They're adamant that someone took their watch. So thinking about how we redirected earlier and what we discussed, how should we respond? Yes, remember with the house keys, we let them know, oh, I'm sorry that your keys are missing. Let me look for them for you. So that's the first thing is that we want to apologize that their item is missing, and let them know that we're going to help them in looking for them. What can we do after that so that they don't keep spiraling into their frustration and getting more and more upset? So exactly. To redirect them, offer them their favorite snack or something that they like. My person with their necklace, personally, she loved Coke. She had to have Coke. Obviously, Coca-Cola is not that good for someone. However, her daughter would buy her these little tiny cans of soda. So whenever she was really to the point where we couldn't redirect or anything like that, Coke was my go-to. That or those black and white movies. So offering them their favorite snack, putting on a favorite movie. Um, yes, maybe do you want to eat your sandwich? Maybe it's lunchtime or dinner time, so you can redirect them to that. So redirecting them is going to be in key so that their mind is not on that watch being stolen. They know that you're going to look for it and you've had them do something else to take their attention off of that. This scenario, you came in to take care of someone, and their response is, "Who are you? Where is my daughter, my son, um, Carlos, my caregiver?" They're asking for someone in directing, or but they don't know either that it's you. Maybe you are that person. Without reasoning with them or arguing that you are the person that they're asking for, because again, they have dementia and Alzheimer's, so they don't remember you now. How can you respond? I know a lot of us have dealt with this in caring for others. So remember, their reality is not our reality, and they don't recognize you. You can introduce yourself, remind them who you are. So one trick for this, sometimes introducing yourself and reminding them who you are, they still might be combative, they still might be frustrated, they might not believe that you're that person. So another technique would to be to tell them, oh, they're at work right now, they'll be with us later, or maybe they remember their son at 10 years old playing soccer, and you know that about the person, or you are their son and you used to play soccer and you know that they remember that. You might say, oh, he's playing soccer right now, but he'll be with us later. How about we go ahead and um, make some lunch? Are you hungry? Or how about we put on, the news for you? So yes, letting them know what you're going to do, but oftentimes using that technique of just being in their reality with them and letting them know that that person will be there later, and kind of redirecting them to something else can help ease you into the time that you have in taking care for that person. I think this is one of the last scenarios. In this one, the person's been reminiscing about their favorite summer vacation, where they spent several summers at a younger age. These are pleasant times for them to reminisce on, but now it's time to shower and change for bed. How can you get them back on track? Sometimes when they're reminiscing, it's hard to kind of cut into that conversation and let them know it's time to shower and change for bed. How can you ease into that conversation? There's different techniques for this one. Me in particularly, I would probably let them know that sounds amazing, that vacation. Yes, distract them by changing the topic. Let them know, wow, that sounds amazing. I can't wait till, I can go there one day. Or I can't wait to hear about this more tomorrow. Um, yes, exactly where I was going with this. I would love to hear more about this after your shower, or I can't wait to hear more about this tomorrow or later today. How about we go ahead and get you ready for your shower so we can get changed for bed? Something like that, just to let them know that you're hearing them, you're listening to them, you're interested in that conversation that they're reminiscing on, but you're getting them back on track so that you can still complete the tasks that you need to complete while you're with that person. So as we conclude this presentation, it's important that we understand that good communication is important. It helps us understand their needs. It helps us understand their emotions, this redirecting. It helps us reduce agitation and frustration, and it helps us maintain their quality of life. It helps us maintain their happiness and their overall well-being.